Welcome to NAHUD's series, Bridging HIV and SUD Innovations in the Field. Today's session is the Indigenous HIV and AIDS Syndemic Strategy, weaving together the National HIV, STI, and Viral Hepatitis Plans. My name is Ashley Johnson, and my pronouns are she, her. We invite you to use the chat to engage with your fellow attendees, drop your name, organization, and we'd like to add a fun one today. What is your favorite go-to snack? Throughout the session, please use the Q&A pod to ask your questions. The speaker will address them at the end of the presentation. Today's session will be recorded and a PDF of the presentation slides will be added to NAHUD's website as a resource. You will receive this information in the post-webinar email that will be sent out through Zoom. You can also visit NAHUD's resource page on the website to find this resource and view past sessions. NAHUD is a membership organization of 8 regional and 2 national AIDS Education and Training Centers, AETCs, that support the AETC program mission. Established in 2010, NAHUD supports the AETCs, a component of the HRSA-funded Ryan White HIV and AIDS program, which have an explicit directive to build and maintain a well-educated and culturally sensitive health professions workforce that can provide prevention, diagnosis, care and treatment, and medical management for people at risk for living with HIV. At risk for and living with HIV, sorry. NAHUD collaborates with multiple organizations in order to promote and educate on the work of the AETC program. Since 2018, NAHUD has been funded by the American Academy of Addiction Psychiatry as a partner organization of the Opioid Response Network to address the intersection of HIV and opioid use disorder. ORN was created to support efforts in addressing the prevention, treatment, recovery, and harm reduction of opioid use disorders and other substance use disorders through the provision of locally designed education and training. Visit the website to submit a TA request, read case studies, see featured resources, check out ORN events, trainings, and learn more about ORN workshops addressing health disparities and more. There will be a post-evaluation survey that will be emailed after today's webinar and must be completed within 2 weeks. We will also drop the link in the chat for your convenience. We will be offering CME, nursing, social work, and a certificate of attendance for completion of the evaluation. A minimum requirement of 60%, which is 36 minutes, of the scheduled session must be attended in order for you to receive your CE. Certificates will be emailed within 3 weeks of completing the evaluation. Continuing education credits are issued for participation in the CE activity and may not apply towards your license renewal in all states. So it's up to you to verify the requirements of your licensing board. And now I'm going to introduce our speaker. Today, we have the pleasure of having Joshua Cody Knight. He is a team member of the Oklahoma Area Tribal Epidemiology Center and Southern Plains Tribal Health Board. Cody supports the works with tribal organizations to provide guidance and technical assistance surrounding HIV, hepatitis, and STI treatment and prevention policies, procedures, and other related inquiries as made by citizens, providers, and tribal leaders. Cody leads a team of staff responsible for program development, implementation, and evaluation for clinical and community partners. He is leading the national expansion of the self-collection program Indigi-I Want a Kit, or Indigi-IWTK, and the creature of National HIV self-testing program, Native Test. These programs offer free confidential testing of HIV, hepatitis, syphilis, chlamydia, gonorrhea, and trichomoniasis. These programs have reached over 4,000 people and have self-test kits and is rapidly expanding STI self-collection. He earned a Master's of Public Health degree from the University of Oklahoma Hudson School of Public Health and is certified in the public health by the National Board of Public Health Examiners. He earned a Bachelor of Science in Biomedical Science from the University of Central Oklahoma and an Associate of Science from Northern Oklahoma College. And Cody, take it away.
Thank you for that. Always got to add in that junior college. If anybody went, we love them to death and wouldn't be where we are without them. It's nice to see you all. I'm going to go ahead and share my slides. And today, as mentioned, we are going to be talking about the Indigenous HIV/AIDS Syndemic strategy, weaving together the national HIV, STI, and viral hepatitis plans. So I first want to thank the U.S. Department of Health and Human Services, Office of the Assistant Secretary of Health, the Office of Infectious Disease and HIV/AIDS Policy for granting the Indian Health Service, the many years of minority HIV/AIDS funds that made this strategy and the work that we do possible. With the Indigi-HAS, the Indian Health Service and our partners wove together 3 national strategies. One, the HIV National Strategic Plan for the United States, a roadmap of the epidemic 2021 to 2025. Second was the Viral Hepatitis National Strategic Plan, a roadmap to elimination 2021-2025. And then the third was the Sexually Transmitted Infections National Strategic Plan, known as the Syndemic. We think of this creation as an Indigenous pathway, complementary to the national strategies, allowing Indigenous stakeholders to formulate their own responses to the syndemic in their communities by incorporating local governance and Indigenous knowledge. As members and leaders of our Indigenous communities, we will encourage the Indigi-HAS as a process-based roadmap for all the stakeholders to guide the development of policies, services, programs, initiatives, and other actions to achieve the nation's vision of ending the syndemic by 2023. The strategy adopts a syndemic approach, addressing HIV, STIs, and viral hepatitis in an integrated way. A syndemic approach allows with our perspectives on health and wellness. While no singular understanding of health and wellness exists across Indigenous communities, the strategy is grounded in a shared wellness worldview that is holistic. We hope a syndemic approach will promote a broader array of interventions, centering a holistic perspective that aligns with the needs of our communities and honors the principles of Indigenous sovereignty. When I shared my screen, I came up in a big bulletin in front of the presentation, so I got nervous, but we're here. Again, my name is Cody Knight, and thank you for that introduction. I'm an epidemiologist and program manager now at Southern Plains Tribal Health Board and the Oklahoma Area Epidemiology Center, and my pronouns are he, him, and his. The learning objectives that I have for today on this presentation are to introduce you to the Indigi-HIV/AIDS strategy, the Indigi-HAS, inform on the goals and objectives within Indigi-HAS, and identify Indigi-HAS alignments with these existing national strategies that I referenced from the creation. I have no conflict of interest with this presentation. So this QR code takes you directly to the document that I'm going to be talking about today. We're also going to be dropping a link into the chat so that you can pull up this document and reference it while I'm talking about it, or just make sure you can have it for your records. In recognition of the diverse cultures, terminologies, treaties, and priorities across our communities, we may use this strategy to support our community's unique social, economic, cultural, and legal context. And we may adapt and prioritize the goals, objectives, and strategies and measures of progress in the strategy in ways that align within our own communities and within others. I wanted to check and make sure it got in there. Let's see. I just dropped the link in the chat also. So here I want to read this out verbatim because there are a couple of slides that I will read verbatim because of the importance. So the vision of this document is, envisioning a world in which all Indigenous people are healthy in mind, body, and spirit. The spread of HIV, STIs, and viral hepatitis is prevented. Every person knows their status and lives free from stigma and discrimination. And every person has access to high quality, holistic care that reflects Indigenous values, promoting relationships with each other, the land, and all beings. Here, I want to give a big thank you to all those who participated in the advisory committee for this strategy. It couldn't have been done without everybody's contribution, and I'm so thankful to have gotten to experience these individuals myself as one of the contributors to this document. So now for an overview. Here we see the core values. The strategy is core values are centered that partners perceive to be common across many Indigenous communities. These core values that are shared commonly are everything from the shared wisdom, diversity, equity, justice, balance and harmony, healing, and holistic care. Foundational things, love, respect, from the Hawaiian relatives, terminology that was specific to them was added. And these are things that the strategy will continue to be reflected throughout the presentation. So in this next part, the strategy components, what type of intervention or the level of intervention. So when we look at the types of interventions reflected in the strategy, prevention, treatment, diagnosis, and response. Again, pillars as we've seen in the other strategies. And the level of an intervention, on that individual family level, on the community level, and then systems impacts of change that we're wanting to see and support. Okay, are we ready to dive in? So when we first look, we're going to start with sovereignty. In the focus of sovereignty, there is a main message of centering Indigenous sovereignty in the design and delivery of healthcare systems, health systems, including sexual health services. Under this focus area, there are two goals. One, to increase understanding, recognition, and respect related to Indigenous sovereignty, and then to increase health programming both within and outside of Indigenous communities that is grounded in the principles of Indigenous sovereignty. So strategy 1.12 is to increase recognition that body sovereignty is an extension of Indigenous sovereignty. So then when we look at strategies 2.221 and 2.2.2, one is fund and support health programming designed and driven by Indigenous people, including clinical services. And strategy 2 is develop flexible, non-burdensome funding mechanisms that provide Indigenous people opportunities to address community identified needs. For time's sake, we'll not spend, on each of these goals a lot of time, but I have included the objectives and strategies in the following slides that we're going to review. Second, we look at cultural responsiveness. In the focus are of so when we're looking at cultural responsiveness, there again is another main message of delivering culturally and linguistically responsive health services, including sexual health services. Under this focus area, there are again two goals. To enhance, main overview, enhance cultural and linguistic responsiveness of health services and integrate Indigenous philosophies of holistic wellness into Indigenous and other health systems that serve Indigenous people. So in this, we see strategy 3.2.1, train healthcare professionals on how Indigenous communities conceptualize health and wellness, including how to support sex-positive conversations and provide gender-affirming care in a culturally responsive way. Strategy 3.2.2, we talk about expanding clinical training curriculum and programs to include education about principles, values, and conceptual frameworks that are critical to providing that cultural responsive care to Indigenous people. When we move on to strategy 4, we have design and deliver programs that promote behavioral health, including principles of recovery-oriented care. Another part of strategy 4, increase recognition that culture and tradition are medicine and support health and well-being. Again, I don't want to spend a lot of time on each of these goals, but have included the objectives and strategies in the following slides for you to review. And if time allows, just like within the question sections, we'll be happy to come back to any of these. Partnership. In the focus of partnership, there's again in the main message of strengthening partnership to improve systems of care for Indigenous people. Under this focus area, again, some of our goals are to strengthen partnerships within and across Indigenous communities to improve those systems of care, and strengthen partnerships between Indigenous communities and the public and private entities that can help improve these systems of care for Indigenous people. Strategy 6.1.1 ensures that Indigenous health organizations are meaningfully engaged in coordinated, comprehensive approaches to address HIV, viral hepatitis, STIs across the broader health system. Strategy 6.2.1 is to create mutually agreed upon approaches to address the strength of relationships and partnerships, including processes for ongoing reflective evaluation of the relationship to ensure that they're maintained and equitable. Again, just as I stated before, the objectives and strategies are going to come up in the following slides. And then awareness and stigma. Reducing sexual health related stigma. So there's 3 goals under here. Increase knowledge and awareness of the relationship between sexual health and overall health and well-being. Decrease stigma surrounding health, including, HIV, STIs, viral hepatitis, and enhance knowledge and awareness of how to diagnose, treat, and prevent HIV, STIs, and viral hepatitis. Strategies within this area are to expand public health messaging that frames stigma as an effect of colonialism, and to implement comprehensive community-wide education strategies inclusive of 2S LGBTQ+ people, those with mental health and substance use disorders, people experiencing homelessness, incarcerated or returning citizens, as well as non-beneficiary partners of the IHS, IHS beneficiaries. And again, I will hit those objectives and strategies closer later. When we look at the clinical and resource services, we have looked at developing the capacity to support diagnosis, treatment, prevention, and response to HIV, STIs, and viral hepatitis. 3 goals under this are to increase the availability of accessible and sustainable clinical resources and services across IHS, which is Indian Health Service, tribal and urban health systems. Increase the availability of accessible and sustainable community-centered health systems, and strengthen the workforce across clinical and community-centered health systems. Some of the strategies within this are to provide dedicated funding for outreach and mobile services to get outside of those clinical walls. Improve contact tracing to enable empirical treatment during outreach visits. Strengthen transportation supports to facilities across access to care, and strengthen existing Indigenous health systems and partnerships with public and private partners to enhance access to housing, nutritious food, running water, transportation, and economic opportunities. So when we are looking at data systems, in the focus of data systems, we want to improve the knowledge, evidence, and practices related to Indigenous health and well-being. Goals under this include to strengthen data systems and data sharing process to address information gaps, as we all can relate to there around public health. Increase investments in research and evaluation to improve the knowledge, evidence, and practice base to reference from. Strategies under here include to increase program evaluation and analysis to identify effective programs, promising practices, and other innovations within Indigenous health programming. Encourage implementation of evaluation approaches that honor Indigenous ways of being and knowing, and develop measures including a composite syndemic measure. So indicators, the strategy including indicators to measure progress, which align with the goals and objectives and strategies. Key measures are included in each section, and indicators and an indicators table is included, which provides an extensive list of the indicators from a variety of existing data sources on Indigenous health and wellness, and we will see that too. The section on programs and practices includes a list of programs, training, and additional resources that may support Indigenous communities in achieving the goals and objectives and implementing the strategies presented in the Indigi-HAS. We hope members and leaders of Indigenous communities, as well as our collaborators, use these programs and practices. This section, it will continue to evolve as new knowledge and wisdom is brought forth to be shared. So what you see here is how the cross-sectionality of Indigi-HAS aligns with other national strategies and how comprehensive this document is when formulating a syndemic approach, making sure to cover HIV, STIs, viral hepatitis, and as well as some other pieces that are included in those strategies. We wanted to make sure that this document, whether it be used for a grant application or program development, allows for measure with these strategies that most of our funding sources, most evaluations are based upon, but live as separate entities. This document comprises all of those pieces and is already being used to references for funding applications from funders such as SAMHSA. This document is a cited resource and preferred or in a recommended reference for some of the SAMHSA applications that have already dropped. But we all know in this field of how it is important to focus on an overall sense and not focus on one outcome like just HIV or syphilis or these pieces. We know that's how our funding sometimes comes down, but regardless of how the funding comes down, using a document that is based off of the combination of all of these national strategies can really set up a program community for success, meeting individuals where they are, no matter their health status at the time, where they are in a recovery journey or a treatment plan. Making sure to keep that syndemic approach and that alignment is very important. And this document allows you to keep that in mind without having to go back and specifically reference something out of just one of the national strategies and then be like, okay, well, I'm going to focus on some viral hepatitis stuff. So am I still within my funding bounds of this piece that was based off the HIV national strategy? So we wanted to make sure and highlight that as much as possible. I also wanted to reference that this document lives on Indian Country Echo, which is an amazing resource for anybody within the Indian Health Service, tribal or urban systems that are clinically serving Indigenous individuals, as well as individuals that are practicing you know, here in Oklahoma, we have a very high rural population, and our indigenous systems, our tribal health systems often serve those communities also. And this resource allows clinical reference for treatment, prevention. There's public health initiatives such as the Peer Echo that works with peers around substance use and those pieces. And it all lives in this space, which is also where the I Want the Kit, or Indigi-HAS, HIV/AIDS strategy lives, and as well as some other programs that are referenced within this document in the programs and resource guide. I flew through that because I want to be able to open the floor to questions. There were some questions put, and Ashley is going to come on and moderate those, but I want to thank everyone for being present for this and taking the time to see a perspective that may not be of your own community, but as we all live and work in this space and are, battling against the odds of what we're seeing right now in our, respected fields. All your friends matters, your colleagues, their perspectives, their resources, what can be, help and adapt, can be adapted for your own community. And I'm very thankful for the audience that was allowed for me today, and to be able to show this work and how it can be applicable to your communities or can help support your work with Indigenous communities and partners. And Ashley, do we want to? I
Thank
flew
you.
through
Oh,
that.
yeah.
I'm so sorry. I wanted to have time for questions, and I I went a lot faster than I needed to.
No, it's okay. I'm gonna pull up some of those questions. Um, so sorry.
Oh, you're fine.
Do
And
we have any questions that anyone would like to drop in the Q&A pod?
so there was a few pre-questions that were submitted, and the one of them was, how do we make this plan work nationally? As I referenced, this plan uses the existing national strategies. So it is something that most of us are probably using in an implementation format already, but as individual documents. And so really this is creating an efficiency and a more comprehensive, holistic view to what we're all trying to accomplish, and which most of us are probably already doing in practice, but not from a, overall document standpoint when we think of the strategies. I also, there was a question about talking about home testing options. That was, as I referenced, there are programs and different resources listed on the Indigi-HAS in the Indigi-HAS document. One of those being Indigi I Want the Kit, which is the self-collection program, as well as other resources such as Native Test, which is an HIV self-testing program, as mentioned in my bio. There was a pre-question that asked about how the area of LGBTQS health is introduced in this community and strategy, how it's introduced in the strategy. And the premise, even within the vision, is meant to be inclusive, encompassing of everyone. As stated, it's well-being and all beings. That's that's uh, an Indigenous viewpoint on community is not to be exclusive in any way. And that's, I think, what one was able to bring so many people to the table to put in all of the good work that was required to make this document, but also what guided the principle of making sure that no matter who you were, this with it being Indigenous centered, it's still inclusive of everybody. And that includes, you know, our 2S LGBTQ plus individuals, as well as what was referenced in the document as non-IHS beneficiaries, which would include non-Indigenous individuals. I was going through the chat. If there's any more questions?
I just found that list.
Oh,
With the pre-questions. Sorry about that, Cody, but it sounds like you addressed all of them.
yeah, I think so. And
Yeah.
I I know that I can go back to the chat. Oh, here it is. No, I'm happy to field any type of question from someone if you want to put it out there. It's a good document, which means it might, take a second to fully digest. And I know I went through it really fast, so I'm happy to go back to certain pieces or uh talk on the creation more. My favorite as a program-based person, and maybe a little bit because of my epi background, the uh the illustration of how the alignment of the main messages aligns with the other national strategies table is one of my favorite things because it allows, we all get caught up in, you know, goal 4, objective 4.2 of things. But when when we align all of those goals and objectives under the premise of cultural responsiveness and are able to line all of those up across the HIV national strategy, STI national strategy, viral hepatitis, that's cross-sectionality that, allows for any type of program to use. We we always have worked towards what, in our prospective communities, we always hear like, de-silo, work across fields and things. And this also applies to these national strategies. They, this is in a way deconstructing those walls between the national strategies and where we often see a lot of overlap anyways, because of the work that we all do and how familiar we are with each of those documents.
So we do have some praise in the chat. Folks appreciating the presentation. Someone says, great, this reaffirms what we've been doing for a long time. And getting the recording in PDF would be much appreciated. The recording in PDF of today's presentation will be on NAHU's website as a resource for you all. And it's still not too late to drop any questions if you have any or comments.
And on that, I wanted to say, this document does really just put down in a visualization and a, hard copy, I guess, in a way, of what has already been happening in a lot of the Indigenous communities we all work in. But it was not represented on a national level like this. And we're very, very happy that funders, such as I said with like SAMHSA, is referencing this document as a recommended source or reference when forming applications. And we continue to see this, whether it's from CDC and applications that will hopefully be dropping soon from Minority HIV/AIDS Fund. It's something that we hope is going to not only be pertinent now as we're starting to really take on this syndemic view, but also something that will continue to grow, as mentioned in the presentation about the programs and resources are something that will change, or knowledge bases change as we're able to, can work through some of these strategies in this, where we are developing more knowledge base around Indigenous practice, because we are evaluating, we have a framework now for more evaluation that centers around that Indigenous practice, and can present those in a way that are applicable back to the community. And so this document will continue to live and breathe, as well as if, we have national strategies that are adapted. But it was looking back at the collaborators, we had everyone from public health to the legal systems, clinicians, and from all over, East, West, Alaska, Hawaii. Just as said in the document, that these strategies and principles are to apply for everyone and the outcomes are to apply for everyone. The input was meant to be from as many people and perspectives and communities as possible. And so that's, I'm very honored that I got to be a part of that, because it was definitely one of the most comprehensive conversations that I've been a part of in my work.
Okay, we have put the evaluation link in the chat, and it will also be sent to you via Zoom. So we ask that you complete that as soon as you can, and you can look for your certificate of completion upon completing the evaluation within 3 weeks. We also have an upcoming training next month on July 12th at 12 p.m. Eastern time, and we have dropped that registration link in the chat for your convenience as well. And we hope to see you all there. And it looks like we can give you all back a little time. And we thank you all for being here today, and hope you enjoy the rest of your day and have a wonderful weekend.
Thank you all for your time, and I hope I got you to your 60%.
We'll tweak that.